Hey Guru Nation, how's it going? Thank you so much for watching. Make sure you like, subscribe, comment, share. It means a lot to me. I got a career question today, and I got Jaime Valles, nurse practitioner here. So we actually were talking about this in the car on the way to this clinic. We're here to try to collaborate with one of our, Judy Galindo from Sun Valley Research. So I got asked a question the other day, Jaime, from somebody who has a bachelor's degree, but it's not in science. It's in like politics or something. I don't even know if they have degrees in that, but no, it's not science related. And he was concerned that he can't be a coordinator. And I was telling him, there's like, when we're looking for coordinators, obviously it's helpful to have a bachelor's degree. Obviously it's better if it's science. But oftentimes we get people with associate's degree, we get MAs. I know you and I were talking about a few MAs we can bring, CNAs, and we were also talking about international medical graduates.
Correct.
And technically IMGs don't have, well, they do have bachelor's degree, they have MDs, but the MAs and the CNAs, which a lot of sites are looking to hire as coordinators, they don't have bachelor's degrees. It's not, so the fact that you don't have a bachelor's of science degree is irrelevant, in my opinion.
I would agree.
What were you saying yesterday? We were talking about this about CNAs, and because I didn't know CNA, I'm always talking about MAs are an option. And you were saying, well, what about CNA? Can you explain for Guru Nation? Because hearing from you, maybe like a certified nursing assistant is just as good to be a coordinator.
Oh yeah, definitely. Well, I think the main difference is the MAs will work under the license of the doctor. So the doctor, everything they do is under the provider, because it could be a PA or an MP. But the CNA, they're certified nurse assistants. So they do a little less things, like, for instance, MAs can do shots, CNAs usually don't do shots. But the CNAs are licensed, especially in Arizona, they're licensed, their background checks and all that. So they don't have, what they do, it's their license. What the MA does is usually under the
I
MD.
see.
So the roles are a little different.
But you were saying they get paid basically the same.
It's about the same thing as far as I know, at least in the area where I work. CNAs, they don't do blood draws or they don't do EKGs, and not in their curriculum. But like in the hospital where I work for, they're training to do that, and then they can do them. But MAs do come out of the MA school knowing to do those things.
Knowing how to do that.
So the main thing I believe is CNAs are more meant for hospitals, nursing homes, those home health, those type of things. And MAs, the idea is more for clinics. But both can, I mean, if they're eager, willing, they have the right attitude, they both can.
And that's really all you need in research, because guess what I was when I graduated? I had a bachelor's. I have molecular and cellular biology. But guess what? I was never trained how to draw blood. I was never trained how to do vital signs. But I did those things because I had training once I started working at the research site. So the fact that you have a bachelor's degree and it's not in science is irrelevant. Start applying to sites. Sites need people like you. I almost think that CNAs and MAs have an advantage, even despite not having a bachelor's degree, because they have the capabilities like you just mentioned, and the actual training.
Yeah.
It's loud in here.
It's loud. We're close to an airport.
So that's good. Good advice, Hyman. Thank you very much. So never have featured anything about CNAs here, so I appreciate that.
That's right.
Take care, guys. Bye-bye.